The next presentation, effectiveness of AMT and Slet in alkali burn patients, a comprehensive analysis. Dr. Ankita Singh.
Yes, ma'am. Good morning, all of you. I'm Dr. Ankita. I'm presently working as assistant professor in IGMS, RIO, Patna. My fellowship is from Shankar Deva Nethralaya. This study which I'm presenting is done in Shankar Deva Nethralaya during my fellowship period. So we are talking about effectiveness of AMT and Slet in different phases of alkali burn, a comprehensive analysis. I don't have any financial interest. Ocular burn is the common cause of corneal blindness as they may result in damage to limbal stem cells and cause limbal stem cell deficiency. There are various treatment approaches for acute and chronic phase. First is amniotic membrane transplantation or simple limbal epithelial transplantation. So the aim of my study was to study the surgical outcome of AMT and Slet in unilateral LSCD due to alkali burn. And the main thing about the study was this was the first study done in northeast part of the India. This is a retrospective interventional case study of 40 patients of unilateral alkali burn done at Sri Shankar Deva Nethralaya Tertiary Care Center of Northeast India in duration of 2 years from a clearance from ethical committee of the institute. The patients were divided into 2 groups, acute phase and chronic phase. In acute phase, the AMT was done, and in chronic phase, auto Slet was done, and 20 patients were divided in both the group. This is a video showing placement of amniotic membrane transplantation, which was secured with the suture, and then VCL was placed, and pre-op and post-op analysis was done. So inclusion and exclusion criteria were, inclusion was more than grade 4 alkali burn according to Duer's classification, acute or chronic phase and written informed consent. Exclusion were past history of limbal stem cell surgery, systemic disease associated with LSCD, entropion, ectropion, glaucoma infection, unwilling to participate. This is a video of Slet in which the fibrovascular tissue were excised and AMT was placed and limbal stem cell from contralateral eye were taken and secured with glue and BCL. So the patients were followed up at 1 to 4 weeks and then 2 months, further 3 monthly, then till 1 year post-operatively. The medications used were systemic and topical steroid on tapering dose, cycloplegic and tear substitute. Coming to result shows that there was a male predominance of 3:1 ratio, and the commonest age group involved were 31 to 40 years, and common site of injury was workplace, and causative agent were lime. If we talk about AMT group, 40% of the patient had epithelial defect that healed post-operatively, and mean time of reepithelialization was 3 weeks. This was the scoring criteria which was used to grade the patients in cases of Slet. If we talk about the visual acuity drastically improved from pre-operative to post-operative period in AMT and Slet, both the group, as we can see in table and graph. This is the result which shows in each patient of Slet, clinically, we graded the patient on basis of the clinical feature. If we see the graph, this is the pre-operative and post-operative. In post-operative symblepharon, after 1 year of the follow-up, 80% had grade 1 symblepharon and 20 had grade 2. If we talk about vascularization, 60% doesn't have any vascularization, 40% had grade 1. If we talk about conjunctivalization, 60% doesn't have and 40% has grade 1. And if we talk about corneal opacification, then 70% has clear cornea and 30% has grade 1.
50 seconds to go.
4 patients underwent surgery with focal recurrences with pannus extending to cornea. 2 patients underwent Slet, and 2 patients of Slet underwent DALC. Success rate was 72.8% in AMT and 78.6% in Slet. These are the pre-operative and post-operative pics of AMT. These are the pre-operative and post-operative pics of Slet at 1 year of follow-up. AMT is effective in promoting reepithelialization and reducing inflammation, thus preventing scarring sequelae in late stage. Slet is effective, safe and effective technique in treating LSCD. Corneal stoma and ham can provide protection and nutrition for limbal stem cell without negatively influencing the clinical outcome. So, to conclude, in a developing country like India, with limited facilities in the healthcare system, AMT and Slet are boon for the patient with LSCD, where laboratory facilities are not developed for cultivation of stem cells. These are my references. Thank you.
Just a question for you, Dr. Ankita.
Yes, ma'am.
I would like to know what was your criteria in selecting patients, whether you want to go for just an amniotic membrane or you want to combine Slet with the amniotic membrane. What was the criteria of choosing the patients?
Criteria for AMT group was acute phase, that the patient which are coming within 1 month from the mode of injury, within 1 month. That acute phase we did the AMT only, and in chronic phase, that is the patient of presentation after 3 months of injury, we took it under the Slet group, and only auto slits were included, not allo, in which both eye were involved.
And anything new you've added to the...
Ma'am, this is a well-known fact actually. Everyone is developing everywhere, but not in northern eastern part. It is not done in every center, since it was a tertiary care center where this is the only center where it has been done and no study has been reported. So we had done a retrospective study to compile and present the data that has been done.
Nice results.
Thank you.